Okay, I think we have a nice amount of people we could start with. Baruch Hashem, we have about 80 people. And again, it's tremendous schus for you guys and schus harabim that people made time on Erev Yom Kippur to come out and be present at a shir like this, take part in this. We're um, we're very privileged to have Rav Asher Millman with us today. In addition to being a Chashuv Rav in New Jersey, having his own kahila, he's additionally a medical professional. He's with Hackensack University Medical Center. He has experience as a PA in the nephrology department as well as internal medicine. He's worked both inpatient, outpatient, with experience in emergency medicine as well. And again, in a field like this, with the shilas that we're going to be dealing with, which it's you need them in tandem, medicine as well as halacha. You'd be hard pressed to find someone that really is so shaku on both of those elements. Before we begin, and I turn it over to Rabbi Millman, I just want to thank Torah Suites podcast and newsletter for sponsoring today's event. I'm going to be sharing some of their links afterwards. And if anyone wants, they have a beautiful Dvar Torah that goes out weekly that has various inyanim, halacha, hashkafa, etc. It's a one-stop shop for Torah insights for people to gain from. Just a reminder, in case you didn't hear what I said before, that we have a Q&A box. It should be available on the bottom of your screen if you're on a computer, or on the top of your phone if you're on a phone. That's the main format that we'd prefer for questions. Rabbi Millman's going to be delivering a shir, and we're going to be taking breaks throughout so that we can field some of those questions. If you do have an issue with the question and answer box, please feel free on our chat to post a concise question. Obviously, we're going to be looking for questions that are as broad as possible, questions that everyone can get something out of Shavakol Nefesh. If it's a very specific question, 59-year-old mother with this list of conditions, we're probably not going to get to it tonight. There are many wonderful Rabbanim that can handle that directly. And without any further ado, please enjoy the share and please feel free to take part in the Q&A.
Okay, thank you very much. Appreciate the introduction. As really you already mentioned, it's really a big Kiddush Hashem to see everybody here. The night before Yom Kippur is quite a busy night in Klal Yisrael, definitely one of the busiest nights of the year, and everybody has a lot to take care of. And I think it's a big Kiddush Hashem to see so many people who already do so much to help so many people to take extra time out of their busy life to increase their knowledge, hopefully, and to even be able to facilitate a greater and broader helping of people in Klal Yisrael. It's really a big inspiration, a big Kiddush Hashem. There's a concept in Hashkafa and in Halacha that many of us are familiar with, and that is sometimes it's our own zechusim, it's our own merits that give us the bracha that we will live another year. And sometimes perhaps we're lacking in our own merits, but we're people that are so critical to Klal Yisrael. We do so much for others that these chos harabim tolaboy, it's the merit of others that actually sustains us for an additional year. And hearing a little bit about who the chaver is over here, the men and ladies who are involved and who are joining, many of you sound like you're in the category of those who have the merit, this chos harabim tolenboy. So before we begin, I just want to give a bracha to everybody here that in this chos harabim, this chos that they're helping other people in pikuach nefesh and chesed, they should have a good gebench diyar, gemar chesima toiva, and they should see nachas from their children, from their mishpachas, and gezunt mazel, bracha, parnasa, and all good zachen for themselves and for all of Klal Yisrael. As everybody here knows, living in the frum world and being involved in the medical profession, it does put us in a unique position. We are tasked, with a lot of the common questions that people ask. Often they're not comfortable asking, other people, and we're often the first line, and often the second or even third line for people in our community in the frum haimish olam that have questions in medicine, in halacha, and we really need to do the most we can to try to make sure that we're knowledgeable in both aspects of what we're doing. From the medical aspect, we've probably all been what we call curbsided, asked a quick medical question on the side. And it's a big privilege that we have that capability. I'm reminded of at least two people in yeshiva, which I do spend a lot of my time spending time there, that came over to me. One was we'll call him a 30 to 40-year-old male who was having some melena, and he was very uncomfortable, and he was scared to go to the doctor. He's never been to a doctor. He's 35 years old. Why should I go to the doctor? I'm young and I'm healthy. And, I pushed him. I said, that's really a concerning symptom. You've had this for a little bit too long. You're a little bit overweight. You're not in such good health. I really, really strongly recommend that you go to, a gastroenterologist. And he did listen. And Baruch Hashem, they were able to find a 1.5 centimeter tumor that had begun to, invade his colon. A similar case, reminded me of a Sunday morning, coming back from yeshiva, and somebody calls me, I'm not feeling well. And it's been, a few weeks where I'm not feeling well, what's going on? It actually was also a case where he was having, some inappropriate bleeding. I said, okay, you're a bit older. You definitely should go to the doctor. The doctor, are you crazy? I should go to the doctor. I don't want to go to the doctor. I said, fine, you called me. That's the recommendation. Calls me back a few hours later, and he goes, I'm really not feeling well. I'm kind of weak. My wife says I don't look so good, and I'm still bleeding. And I'm like, you need to go to the hospital. Forget the doctor. You've gone beyond going to the doctor. You have to go to the hospital. The hospital? Are you crazy? It's a Sunday afternoon. Nothing's wrong with me. I'm going to go take a nap. I'm going to lie down. So, with a bit of tongue in cheek, I said, I don't understand. You called me for help, and I'm giving you a recommendation. And last I checked, napping, doesn't cure bleeding. That's not in Harrison's or in any of the medical textbooks that taking a nap helps somebody stop bleeding. And Baruch Hashem, he finally took the recommendation, and he was having an active bleed from a cancerous tumor, and his hemoglobin was about 5 when he got to the ER. So we are tasked, being in a unique position, to be able to direct people to go to the medical providers that they need, because we're accessible, we're local, we live in the neighborhood, they see us in the stores, they see us in the malls. So it's important for us to be able to, at least as much as we can, to improve the medical knowledge, to make sure that we are always giving people the best recommendations. That's the rewarding part, is all the good save. Sometimes it's also very challenging. The classic case that I'm sure many of us here have gotten, Shabbos afternoon, you just finish your Suda, you go lie down, and you hear a knock on the table, and you have to come out of bed, and they show you that a kid has had a rash for the past 2 weeks. It's not spreading, it's not getting worse, and they just want to know, what's the etiology of the rash. So that sometimes you have to have some extra patience as well. You've had this for 2 weeks. You have a pediatrician locally. It's Shabbos afternoon. Why now? But that's what we do as Klal Yisrael, as Yidden. Kol Yisrael Arevim Zeh Lozeh. We're always there to help other people. And I always love speaking to groups of Chaver of Olam who have this ability and have the ratzon and have the desire to help others in Klal Yisrael. It's really an amazing group of people, and I'm very privileged to be here together. So I'm going to open up the PowerPoint. We'll go through some of the inyanim. Tonight's shir, as it was titled, was the inyan of speaking about IVs and medications and people who are ill on Yom Kippur. Like Ramesh mentioned, it's a very broad topic, and there's a lot of pratim. And many times, one of the first things I always ask people when they call me is, did you speak to your doctor? Did you speak to the professional who's taking care of you? And that's an important aspect in most of the shilas that we have to answer, is you first have to get really their medical professional to get you the information. But tonight we'll try to give a general overview and cover some basic topics. So let me try to share my screen, and I apologize, I'm not excellent at Zoom, but we'll do the best that we can, and we will go from there. Okay, so let's see if we can make some progress over here and try to go through some of these inyanim. And as Moshe said, you can ask some questions, and I'll do the best I can with Siyata Dishmaya to try to answer as best as I could. And let's begin. So before we get into some of the medical aspects of the shir, we need to go through some basic halachas, some of the basic sugya, just so you understand, so to speak, where the halacha is coming from, so you could have a good grasp of the sugya. Sometimes Rabbanim just want to give the psak and not explain the background. My approach, my Messiah, is more to give people the knowledge a little bit so they can understand where it's coming from. So the pasuk says that we derive one of the isurim of Yom Kippur is Shabbos and hilachem v'inisem es nafshay seichem. You have to afflict yourselves, and the Gemara in Yuma darshans that this affliction refers to afkan inoy re'avain. This is referring to lack of eating, which we colloquially call fasting. So there we know, as we're all familiar with, there's an iser of eating and drinking and other inuyim on Yom HaKippurim. What's unique about the Isser of Yom Kippur, which is going to be relevant to intravenous hydration and really nutrition on Yom Kippur, is that the pasuk doesn't say achila, doesn't say you shouldn't eat. By most of the other isurim, the other forbidden parts of the Torah that relate to food consumption, it says achila. Here it says v'inisem. And that's very relevant because the Shagas Aryeh, in a seminal tshuva, explains, the Marmakam, the third one on the right, so says the Shagas Aryeh, because it mentions Inoi, so afilu im achlan shaloi kederach achilasan, even if you ate it in an unusual way, you actually would transgress the Isser of inui on Yom Kippur. In other areas of halacha, if somebody would take treif, chazer, through an intravenous line, he would not transgress the isser of eating chazer. But says the Shagas Aryeh, that on Yom Kippur there's a halacha that's inui, it's affliction, and in any method, pashtus, that you mitigate the affliction, you would be over. And that's also the shita of the Rabbeinu Manayach, Vadas on the left, V'akein das Rabbeinu Manayach, the Yom Kippur Mapilu, Shaloi Kederech Achila, Gam Chayev. So we have at least two of the major paiskim that are of the shita that taking consumption in an unusual way on Yom Kippur would actually transgress the Isser de Araisa of Inui on Yom Kippur. And you look at the bottom, Rabbi Yosef in Yalkut Yosef, he says, L'ch'oira, what we're saying, that according to these shitas, using an IV would actually be an Isser de Araisa if somebody didn't need it, which we'll get to soon, but a normal person who just takes an IV hydration on Yom Kippur, so it could potentially be that these mefarshim in Isser de Araisa. However, it's important to note that this is not the mainstream approach in the Paiskim. If you look at the Chasam Sofer on the top, and I put the whole tshuva down, which obviously we're not going through, but it actually was during the cholera pandemic in Pressburg and in Europe, and he has a very long tshuva, how people should and should not act during the cholera epidemic. Rabbi Shlomo Salanter also had a lot of stories during the cholera epidemic, but it's clear from the Chasam Sofer, which is the top Mari Makam, that it is not like the Shagas Aryeh and not like the Rabbeinu Manayach, that if you eat in an unusual way, it is not an Isser D'Oraisa on Yom Kippur. Yom Kippur parallels all the other Isuri Achila in the Torah. And therefore, the Fida Chasam Sofer, taking any type of intravenous on Yom Kippur would presumably not be an Isser D'Oraisa. That's also the Shita of his son, the Ksav Sofer. Ika the achila, the shleik derech achila, is also not considered an Isser Torah. And if you look at the Binyan Sian, he also, which is Yaakov Ettlinger, one of the big Ashkenazi paiskim, he also is clear that eating in an unusual way would not transgress the Isser of achila on Yom Kippur. So we have the Shagas Aryeh and the Rabbeinu Manayach on one hand, but the vast majority of the paiskim are of the opinion that if you would eat in an unusual fashion on Yom Kippur, so you would not transgress an Isser D'Oraisa of Achila on Yom Kippurim, which is certainly critical when we're discussing what would be the best approach to give somebody. So perhaps at this point in the shiur, one would suggest that maybe it's preferential to use intravenous versus other approaches of other modalities of nutrition and hydration, because there's no Isser D'Oraisa. There is, which is important on the bottom, it's Rav Sternbach and the Chelkos Yayev, Rav Breish, are both clear that there still is an Isser Midirabana. So even though there's no Isser D'Oraisa to take food in an unusual fashion, there would still be an Isser D'Rabanan. So let's review for a minute what we have. On the one hand, we have Rabbeinu Manayach and the Shagas Aryeh that say there is an Isser D'Oraisa to eat food in an unusual way, which presumably would include intravenous. You have the vast majority of paiskim, on the other hand, who say no, that would not be the case. There is no Isser D'Oraisa, but there still is an Isser Midirabbanan. So even if it's not forbidden on a D'Oraisa level, the Rabbanan, it's still going to be Aser. So let's take these pieces that we have now and try to plug it in to a few of the medical scenarios. And the consensus is, like we said, that there is no Isser D'Oraisa, but there is an Isser Midirabbanan. So the question that we get asked all the time is, we live in 21st century America, and they invented this thing called an intravenous catheter, and it's amazing. I can get an IV placed before Yom Kippur. Why should I have any discomfort on Yom Kippur? I get uncomfortable, even a little bit of discomfort, when I don't eat or drink, and IV hydration would presumably help me feel better. So should a regular person without any health issues get an IV placed to hydrate on Yom Kippur to alleviate the standard discomfort of fasting? And I think if anyone's paying even a little bit of attention, and in a typical shiur in person, I would ask the Olam, but for technical purposes, we're not going to approach it in that way, so I'll ask it as a rhetorical question. But if anyone's paying a little bit of attention, the answer would be obviously not. First of all, there is the approach of the Shagas Aryeh that there is an Isser D'Oraisa to get IV hydration or any type of l'chayra, unnatural food consumption. And even if, like we said earlier, we don't go with that approach, but there is at least an Isser Dirabanan to take food and hydration in an unusual fashion on Yom Kippur. And therefore, there's no heter to transgress an Isser Midirabanan just because you're a little bit uncomfortable. And that's how Rav Sternbuch says it explicitly in one of his trubas. It is hard to fast, right? We all know that. Potentially, that's what the inui is. There's supposed to be some self-affliction on Yom Kippur. He says maybe even deraisa, I'm not getting into that now, for a standard healthy person. So in terms of the first medical halachic takeaway at the night shir, even if somebody would get the IV placed before Yom Kippur, so we're not speaking about having the isurim of putting an IV on Yom Kippur, but just to hook up a bag of normal saline or LR on Yom Kippur for a standard person, it would be inappropriate api halacha, it would be shalei api halacha for somebody to do such a intervention. Fine. That's a pretty easy shaila. Now let's go to the other extreme. Let's say we have somebody, and we'll speak about them soon, what cases it would be, somebody who is definitely a chayla sheyesh bo sakana. He's a person with a life-threatening illness, or somebody who's a safek, which in halacha, in pekuach nefesh, we treat it as a life-threatening illness. And his doctor tells him, you have to hydrate. So we have two options. Either he can hydrate through intravenous, or he can hydrate PO through oral hydration. And the question is, what is preferable? So there's a seminal tshuva of Rav Moshe Feinstein, and there's really a second tshuva of Rav Moshe. And Rav Moshe gives Sachakol in the aggregate 4 reasons why, if somebody was told by their doctor, by their medical professional, that they need to drink, that they should not put an IV, and instead they should do regular oral consumption. Now, we're not going to get into shiurim versus full eating. We'll get into that in a minute. But let's just make it binary right now. A person who has a life-threatening illness who needs to take hydration on Yom Kippur. Let's give an easy example. Somebody who has, chronic kidney disease at the way end of stage 4, where we know that if they don't hydrate, the risks for hyperkalemia, the risks for going into end-stage renal and to requiring dialysis, somebody who's mamish at the way end. What would they do on Yom Kippur? Should they get an IV, or should they take oral intake, which is what we call shiurim, or even more? We'll get into details in a minute. So Rav Moshe says, and it's a bit small, I apologize, and in my old age, it's a little bit hard to read them. Rav Moshe goes through 4 reasons why one should not take the intravenous approach. The first reason, which could potentially be negated, he says there's an Isser D'Oraisa to put an IV in somebody who's not a chayla, who doesn't need it. To put that in is an Isser D'Oraisa. That's the first reason of Rav Moshe. So that, you're right, you could avoid by putting it in before. But says Rav Moshe another reason. Aval mikol makayim, by the second number, nira she'aser le'echel af she'tzarech le'echel harbe v'ak she'after litin laya intravenous be'erev Yom Kippur ki levad she'ena doime la'achila mamish. He says, first of all, as great as IV hydration is, and in some of the Haimish Olam, all they would need would be an IV bag and a Z-Pack, and they think they can cure any illness. But says Rav Moshe, first of all, it's not the same. And he gives another reason. He says that also, we still always discover that medications and interventions right now, we think they're totally safe, but potentially we may discover in the future that there's a harm to them, right? Thalidomide is the famous medication that came out for anti-nausea for pregnant ladies in the 60s, and it came out not that long after that it caused severe birth defects. And we discover all the time where some medications that we thought were useless actually have a lot of utility, and some medications that we think are totally harmless actually have in them significant harm. So says Rav Moshe, first of all, putting the IV in is a problem, which you could get around by doing it before, it's true. The second issue is that it's not the same as normal PO intake, and people might feel very distressed. They might feel very hungry with getting it through IV, and their stomach is uncomfortable, and that pain can exacerbate their illness. I mean, to speak personally, I was once NPO for 7 days. Yes, it is possible. And even with an IV bag hanging with some electrolytes, let me tell you, it was an extremely uncomfortable experience. So I can certainly relate to what Ramesha is saying, that even if you're getting the appropriate hydration, but the body is still under significant distress. And he says, perhaps we may discover that IV hydration is not the panacea, is not the cure all and be all that we thought it was. And another reason, he says, on the top left, is that you have no right to cause yourself a chavala, a damage, a wound, which is potentially an isra d'oraisa if it's not for a medical purpose. So Ramesha is very clear that there are 4 reasons why. One, if they need to hydrate themselves, that they should do it normally, and he says that clearly on the bottom. Intravenous. What they should do is they should do a regular oral intake. And that's not only the Shita of Rav Moshe, it's also the Tzitz Eliezer, Rav Waldenberg Zatzal, who wrote many chalakim about medical halacha. Shouldn't find some replacement, which is intravenous. Not even b'diavad, it's totally mutter. And that's also brought in Reb Sternbach. To eat with a intravenous. So that is the consensus of the major heavy hitters in medical halacha, Ramesha, the Tzitz Eliezer, and Reb Sternbach, who are all very clear that somebody who needs to hydrate due to a life-threatening illness or a potentially life-threatening illness, they should do it in a normative fashion. And what they should not do is try to play around with an IV because of the four reasons of Ramesha and some other reasons as well. One caveat to this halacha is the next nakuda. I'll give you an example, a case that I've been dealing with recently, the past few weeks. It was a young, relatively healthy person who had a chronic condition that he has some intermittent immunosuppression. And unfortunately, he contracted a very significant infection. And the infection, because there's no HIPAA violation, he contracted salmonella, which became salmonella bacteremia, which anybody who knows what that means is quite frightening. He went into septic shock. He was on pressors. His liver function was through the roof. His kidney function was compromised. It was a very, very scary situation for a relatively young, healthy person. Ultimately, Baruch Hashem, after a few weeks in the hospital, he was able to come home. And they're monitoring his labs continuously, and he's still getting IV antibiotics at home, daily. I think he's getting ceftriaxone, if I recall correctly. So somebody like this who already has a port or an IV in place. So the question is, and he's commonly getting hydrated through IV hydration, and assuming he doesn't need nutrition. So the question is, maybe somebody like him who already has the IV in place, and this is his regular fashion, his regular method of getting hydrated. So the question is, maybe in this case, there's some allowance, or maybe it might be recommended. I can't say definitively. But in this case, perhaps the price can suggest, maybe in this case, it would be okay to go with the IV hydration. It's true you don't have all of Rav Moshe's reasons, but if you look at Rav Sternbach and the Piskin from Shmuel Kamenetsky, Shlita, they both discuss how in this case, perhaps if somebody really wants to do IV, you should allow them to do it because it's already in place, their body's already used to it, and perhaps they would be okay. But typically, in the standard scenario, the clear consensus of the Piskin is that you do oral intake if that's what's required for hydration and nutrition. So what are some common scenarios of life-threatening or potentially life-threatening illnesses? So I'm sure many of you know this, but we'll just go over some of them for a minute. Obviously, severe dehydration, if somebody is extremely weak, if they're dizzy, if they have an altered mental status, if they're hyperglycemic, if they have, chronic kidney disease or certainly end-stage renal disease, where the concern of progressing, of going into acute kidney illness, hyperkalemia. Somebody called me today for a shaila. He only has one functioning kidney, and his GFR is quite low. What should he do? And he was quite shocked when I told him that he should do shiurim, which we'll get to in a minute, on Yom Kippur, because I feel totally fine. I said, nobody comes into the hospital with an acute kidney injury and says, my kidneys are hurting me, right? Most times AKI the most common cause is a lack of renal perfusion, a lack of hydration to the kidneys. So I told him he's definitely mechuyev because he has a very high risk for progressing severe liver disease, advanced cirrhosis with unstable electrolytes. Neurologic disease, epilepsy, common, from in many cases, even in well-managed people, it can affect the sodium channels and the membranes. Pregnant women with concerning symptoms, severe weakness, dizziness, abdominal pain, contractions that are continuous, bleeding, signs of preterm labor or decreased fetal movement. Certainly infections with fever, sepsis risk, or worsening weakness. That's no shaila. People always ask about elderly and frail people. It's impossible to give a rule that every old person should fast or every old person shouldn't fast. But certainly people who are very unstable, who are very weak, perhaps even those who have a lot of chronic UTIs and that puts them at a high risk, or perhaps those who have a high risk of delirium, where their oral intake is diminished. Certainly in many of those cases it would be appropriate for them not to fast entirely. Maybe shiurim would be appropriate, but certainly they should at least have some oifen of eating and drinking. Recent major surgeries, the body undergoes a lot of trauma and a lot of stress after surgery. Major cardiac surgery, someone just had a resection or a triple bypass, some advanced neurosurgery. Obviously, every case has to be done specifically, but just a generality, the post-surgical time period is a pretty high risk period. The body's hyperinflammatory. The body usually is malnourished, so that'd be an important caveat to remember that many of those patients also might qualify. Most patients, again, I can't say always, but are undergoing active oncology treatment. I'm not saying somebody who has who's on stable medication for many years, perhaps not, but in many occasions undergoing real active chemo, many of those patients are quite ill, and even having one day of lack of nutrition or hydration in many cases could cause them to have some risk, and therefore we'd avoid it. And obviously in many cases, I can't say all cases, but in many of the eating disorders as well, advanced anorexia, advanced bulimia, these are very, very, very high risk conditions. I mean, the mortality and morbidity of anorexia is like through the roof. So we typically try not to make significant changes to these people. Of course, every case specifically has to be analyzed with their provider, but just be aware, these are some cases. I'm sure there's many more, but I want to give some common scenarios of life-threatening or potentially, which is a suffix. Let's go through shiurim, and then I'm going to take a break for a minute, and maybe we'll field some questions. So how do we give these patients nutrition and hydration if they don't need regular full volume intake? Shiurim is only for somebody who their doctor, their provider tells them they don't need to eat and drink normally. For some people, it's possible that in their condition, they need much more than what shiurim would be able to provide for them. And in those cases, they have to eat normally. But let's go for many cases, shiurim would be sufficient. Now, shiurim is involved both in eating and in drinking. Let's go through some of the numbers. And like I said, then we'll pause for a minute. So the shear of Yom Kippur is koseves gasa, which is approximately 1 to 1.5 fluid ounces. So usually the recommendation is you take a schnapps cup and a little bit more, and you fill it with either bread or crackers or cereal, and make sure there's no air space because you have to fill the full volume. And you can measure it before, if I recall correctly, maybe it's like 13 or 14 Cheerios. Please don't quote me on that. Maybe with shrinkflation, they've gotten a bit smaller, but that's what I remember from a few years ago. And you can have that ideally every 9 minutes. If that's not sufficient, every 7, then 5, and then 4. Again, it's important to qualify. If somebody is acutely ill and they need full hydration or nutrition, for them, shiurim is not what we're going to use. We're going to use regular oral intake, but this is somebody who it's sufficient. The classic case would be the CKD patient. They just need some hydration. So what's hydration? It's mole lugmav, which is a cheekful, and that's usually individualized. So everybody's cheek is a little bit different. People say you have a big mouth. It could be that's a metaphor, but some people do have bigger cheeks. What's average is about 1.5 ounces, but of course, if you're able to measure, so then you measure, and we do a little bit below that. And again, also, ideally is every 9 minutes, then every 7, then 5, then 4. And for drinking, it's a little bit more lenient. It could be even every 2 minutes. And the nice part about shiurim is they don't join together. They're not mitzdarif. So for example, let's say you're somebody who's going at the longest, you're 9 minutes. So at minute 0, you could have some food. 4.5 minutes later, you could have some drink. Then 4.5 minutes later, again, you could have some food. So every 4.5 minutes, you're having achila, then you're having shasiya, then achila, then shasiya. And in a 30 to 40 minute span, you really are able to get some pretty decent oral intake, both with eating and with drinking. So this person who I mentioned, who has only one functioning kidney with pretty advanced CKD, so I told him, do the shiur of 9 minutes for drinking. You should do about a liter and a liter to a half of intake for Yom Kippur. So figure out how you want to do it. It doesn't really matter if you have it a little bit in the morning, a little bit in the middle of the day, a little bit in the afternoon, a little bit even later in the day. As long as you're getting that amount, to me that would be appropriate for him. And this is a general overview of how you do shiurim, which would be appropriate in many cases of those who need to eat and those who need to drink. One more time, just to chazer it again, because review hopefully we'll bring it into our heads. If you think somebody needs more than this and you have a suffix of yesh bo sakana, there's a potentially life-threatening illness, please don't start measuring shot glasses when somebody is about to syncopize on the floor and or they're hypoglycemic. Please don't start measuring with shot glasses because the rabbi said I have to do shiurim. If somebody is in a critical illness or they're impending critical illness, please just feed them and let them drink appropriately. Maybe once they recover, once they're a bit more stable in a chanami, they need to be allowed to go to shiurim. But this would be used in a stable patient who's directed before they need to eat or to drink. Okay, we'll leave this out for let's pause for questions now, and then we'll discuss when would an IV be appropriate.
Okay, so thank you so much for that. Very informative and a lot of information. I'm sure people are going to watch this multiple times. I'm just trying to slice through a bunch of the Q&As. So I'm going to ask questions, I guess, that are broad just to get a little bit of clarity. So one of the things that we wanted to discuss, and this really cuts across a bunch of the cases. It sounds like, and please correct me if I'm wrong, the first stop should always be the doctor or the medical provider, meaning ask that medical provider. For instance, one of the people asked about kidney stones. We have a woman that's postpartum. We have a woman that's in her last term, her last trimester. The person that's
Mm-hmm.
being asked the first question is the medical provider, not the Rav. Is that correct?
Typically the best shilas that are asked that I get are people who have spoken to their doctor first, because kidney stones is super vague. For example, somebody could have had one episode of nephrolithiasis 20 years ago and they've had no repeat since. Okay, is a one-time kidney stone really nachshav? I don't know. It depends what the doctor says. It's likely a doctor would say one time many years ago, hydrate before, maybe not. Versus somebody who has chronic, kidney stones and they're constantly getting it. They had they even had some obstructed stones once, and they've had some pyelonephritis. So to me, that would be a very different psak. They're at a significant risk for a life-threatening illness. To me, that would be much easier to tell them, or I would tell them in that case, most likely to at least do shiurim to maintain their hydration. So typically, it's important to ask their doctor or their provider before, just to understand where they're coming from. That way, I
Got
could give a more appropriate answer.
got it. Thank you. And then a follow-up, you might touch on this. You could tell me to pause on this particular question. The question was asked, if a woman is told to, let's say, do shiurim, there would be a nafkamina between whether she had the IV placed before Yom Kippur or on Yom Kippur, I would imagine, correct? Meaning a woman's told, I
Again,
want you to eat on Yom Kippur.
shiurim or IV. Which one are you speaking about?
A woman's told you should be eating. You need to do shiurim by her OBGYN. So,
Okay.
and again, if you want to handle this later, feel free. So
No,
the
no, no, no.
question is there a frumkite on the side of IV in any of that
No,
scenarios, or is the
that
frumkite the
that's
dafka eat?
that that's what we're seeing for Ramesha and for Sternbach. They're all writing that one. I don't. Ramesha is for sure saying that, and Sternbach and the Tzitzi are quite clear as well that it's not a frumkite. I'm saying it's not midas chasidus. One should do what is best for that person. A person Ramesha says it's an isser to put an IV that's inappropriate. Even before an isser to be chayvel atzmai. So we don't know what the effects of the IV are. It's not the same as typical oral intake. So Ramesha is very clear. It's not even b'shayfi. That's not my Messiah. Again, there are other Messiahs. To me, Ramosha is very clear that the Messiah is that these people, what they do is they do shiurim. That's what the Messiah, my Messiah, and that many people have this Messiah, that we don't put IVs in these people. It's not a midas chasidus. No, it'd be appropriate to do shiurim.
Got it. Thank you. And again, trying to bunch a couple things together. One thing that we
Mm-hmm.
touched on was eating disorders. It sounded like the Rav was saying with clarity. If someone has an eating disorder, we keep them eating regular. We don't even touch that.
Again, it depends. I said it. In most cases, somebody who if somebody has a mild, in most cases, the answer would be yes. Obviously, you'd have to go through the case, but somebody who has real anorexia nervosa and they've been hospitalized and they suffer a lot with eating and consumption and changing habits, for many of those people, even a 25-hour fast, either emotionally or physiologically, especially if they're not well controlled, can have a significant risk. And in many of those cases, I would tell them definitely to do shiurim.
Got it. And again, al regalachas, no one should take this psak lamaisa because obviously it's situation based. Someone's asking if someone has hyperemesis first, second trimester or early second,
Yeah,
should they be fasting?
hyperemesis. I mean, for them, for carrot, sometimes for them they actually need the IV because they can't keep down the PO intake. Somebody who's having HG, in most cases they should not be fasting. No. Again, they
Got
could
it.
do shiurim or they could do IV. The only reason why I say IV in that case is because that's often one of the treatments for HG. If the Zofan and the Reglan's not working, often what they'll do is they'll do intravenous, and many people have it in their home. So if I care, for them, the IV is the medical intervention. That's the better medical intervention. But if someone has, real HG, which is dehydration, fetal hypoperfusion, there's risk of hypotension, electrolyte disarray. We don't mess with that. HG is a real condition. I see people in the hospital all the time. I've had many ladies, under my service who've come in with HG with real AKIs. They weren't managing it; they thought it's okay, and they had some significant kidney issues, and that's not what you need on top of a pregnancy to try to manage, some acute kidney injury as well. So in most
Right.
cases, again, I can't say in all cases, like you said, but in most cases, yes, it'd be appropriate for somebody with HG to have some type of intake on Yom Kippur.
Got it. I'll ask one more Clelly question, and I'll let the Rav continue. Someone's asking as a Hatzalah paramedic, you're the medical provider, you're the EMT, the medic that shows up. How
Mm-hmm.
hard do you have to bash the person over the head to get you to listen to them that they need to eat or they need to take care of themselves?
That if I had the answer to that question, I could already be retired. I always joke, and that trying to when you deal with from people and going to the hospital, excuse the muscle, but I really feel it's like a Jackie Mason routine. First, they call you and they do not want to go to the hospital. There's no way they're going to the hospital. To the hospital, you Michigan, are you crazy? It's Erev this, it's this. I have a chasa, I have a simcha. I'm not going to the hospital. After an hour or two, you convince them to go to the hospital. Next, they want to know, well, let's go. Where's Hatzalah? I want to go to the hospital. Fine, you get them to the hospital. They get to the ER. They call you 2 minutes later. What do they want to know? Oh, they want to know where's the ER doctor? Come on, I've been waiting here 5 minutes. Fine, fine. You get the ER doctor to see them, and they say they have to be admitted. Admitted? Are you crazy? I'm not staying. I have things to do. After an hour or two, you convince them they have to be admitted. What happens next? Well, what am I getting my bed upstairs? 2 minutes ago, you wanted to go home. Now you're chashing for your bed upstairs. They finally get upstairs. They finally get a bed. They get a room. And the next question is, when are they going home? So, part of working in the frum world is you have those challenges. You have to tell them you're mechuyev. I'm saying there's many stories of the G'dayler Mibishal Salanter used to went around during the pandemic, the cholera pandemic, and he gave out food to people. He told them to eat. Reb Chaim Brisker was very machmir. He would also make people eat. There's a story with I think one of the Belzer Rebbe's. He used to keep food in his pocket in the clothes on Yom Kippur, and when he saw a chassid who was weak, he would give it to him. So that's the halacha. The same way you're machmir, on other areas of halacha. Pikuach nefesh is doicha, except for the gimel of eres chamurais. We have to be machmir pikuach nefesh. You have to try very, very hard. Tell these people, this is your avodas Hashem. Grace tzaddikim, bigger people than you, have eaten and they've drank on Yom Kippur, and this is your avodas Hashem. Your avodah is not to fast. Your avodah is to eat and drink, because that way you'll be able to mekayim many more mitzvahs. But yeah, that's much easier said than done, as many of us are familiar with.
Of course. Okay, I'm gonna let the Rav continue.
Okay, so let's do a few more nakudas. So when would an IV be appropriate? After bashing IVs for the first 15 minutes, which hopefully no one will get upset at me that I'm knocking out their businesses. When would an IV be appropriate? So this requires a little bit of nuance, but I think the general case, and I'll give you one example where I tell a lady who calls me every year, and this point she already knows. She's a relatively healthy lady. She doesn't have any significant past medical history. She's pretty young, and she has severe migraines that are debilitating to the point where if she doesn't eat for a few hours, she's under tremendous agony and tremendous tsar. So in a case like her, it's hard to say there's a sakana for her not to eat, because she doesn't have any past medical history. She's pretty young. She's pretty healthy. And people with migraines, Rahman al they do suffer a lot, but we don't have a lot of people coming into the hospital in their 20s or 30s, with an MI induced from the pain from a migraine. But to tell a lady like this that she has to suffer like that, with that extent, so there is a concept that she would be nechshav a she'ein bo sakana, a who doesn't have injury, who doesn't have danger. And in a case like hers, it would be appropriate before to put an IV in, because like we said, according to the consensus of the major paiskim, intravenous hydration is only an isser. I don't mean only, I'm sorry, it's a poor terminology, is an Isser Derabanan, and therefore b'makam chayli loy gazru. So that would be one classic case, and I don't have so many other cases where it's like this. Maybe the HG case, that's more a medical case, but that would be a good classic case where somebody has no sakana, it's not dangerous, but they're not mechuyev to suffer, to the extreme of sitting in bed with a 10 out of 10 pounding headache for 25 hours. So that's one of the cases, and you can extrapolate other cases where perhaps it would be appropriate, but again, that's not in most cases. Okay. Let's segue to a little bit of a secondary topic. which is quite related, and that's taking pills on Yom Kippur. One of the many shilas that I get all the time, many Rabbanim Pesach send me, there's Mispalim, we go through all their medications, it's like a full med rec for like 500 people on Erev Yom Kippur. But for pills that are for life-threatening or potentially life-threatening illnesses, you are allowed to take it with a little bit of water. That's clear in Ramesha. If you're able to dry swallow, which many people can, so Matovu Manayim, that is a bit better. But it says Rav Moshe, Avo benidain zeh yesh lahatir gam b'mayim. You could have them take it even with a little bit of water. If they can't do it without water. And that, I think, for many people is pretty simple to understand. We'll go through the medications in a minute. But for most life-threatening or potentially life-threatening illnesses and for critical medications, so typically, lechatchila, they should try to do it without water. If they're unable to dry swallow, then they could do it with water. For a chedesh she'ein bo sakana, somebody who takes a medication for a non-life-threatening illness, but let's say it would make them very uncomfortable. A classic case would be somebody who has, let's say, terrible allergies, and they're going to be in a lot of discomfort if they don't take this medication on Yom Kippur. So the place can say, which is a little bit of a hard psak, that Shlomo Zalman and the Rebbe Tzina B'Shu'ul, they both say, and many other places can say this as well, you have to somehow make the water a little bit inedible or unedible. Meaning you have to somehow make it bitter tasting, and there's many ways to do it. We're not going into all the ways how to do it, but the water has to be to the point that it's not ra'i la'achila or l'shasiya, and once it's no longer ra'i la'achila or l'shasiya, so then they could take it even for a non-life-threatening illness. The classic case is an antihistamine. Somebody has, again, terrible allergies, and they want to take it. And in this case, I will tell them they don't have to suffer the whole Yom Kippur. They could, but they have to be paigim the water. Yeah, some places can say put a little bit of soap. That's very hard. I spoke to a big paisik yesterday. Just I want to hear, his aid says he tells people to take it with my lanta. I thought that was an interesting approach. He says my lanta is not roy la'achila. It's not considered a bittul of their tinus. And fakert, some people who have an empty stomach anyway, they have some, worsening acid reflux. So maybe they'll get some benefit. So he was married to people that take medications for a non-life-threatening illness to take it with Mylanta. But again, sometimes you can get some unflavored tonic water, some quinine concentrate, which is very bitter. Really, 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 the place can say if you have a very, very, very bitter tea essence, that's also not right la'achila, that potentially could also be. Again, I'm not getting into the details of how you make your water not right la'shasiya, but that's the general split. For medications that are for critical or potentially life-threatening illnesses, you can take it with dry swallow. If not, you take it with a little bit of water. For a non-life-threatening illness, you have to be plugging in the water, and everyone can go through it as they see fit. Let's go through some of the common medications. And again, there's a million medications that people take, but let's go through some of the common ones. Obviously, antiarrhythmics, amiodarone, metoprolol, digoxin, any of those medications. Don't tell anybody not to take their metoprolol on Yom Kippur. But Rabbi, I haven't had AFib in like 20 years. Yeah, I understand, because you take your medication, right? You skip one day of medication, the body's under some physiologic stress. It definitely can be prone to induce that. Obviously, anticoagulants, blood thinners, warfarin, Eliquis, some of the dual antiplatelet therapies. Obviously, we don't want to skip those doses. They can precipitate, a VTE, potentially a PE. For people who have stents, obviously it can precipitate, an MI. So we certainly don't mess around with those medications. Like we said, antiplatelet drugs, aspirin, Plavix, all those medications as well. We don't skip those medications. Even one skip dose can create some type of thrombus or, platelet aggregation, which raises the risk. Antihypertensives. So it's a little bit tricky. I say in most cases, certainly, I tell people try not to skip them. There is a long half-life to these medications, but you are risking somebody who has severe hypertension. It's not so simple to tell them to skip. Maybe, again, it's a theoretical, somebody who has a very mild hypertension, their pressures, their max pressure they've had is 130 over 78, and they have a very aggressive PCP or cardiologist, and they take a low dose of 5 milligrams of lisinopril. Okay, maybe in that case, I could hear that they could skip it for one day. Obviously, if the doctor says no, it would be definitively not. But most doctors, I think, would say in a case like that, it would be appropriate. But in many cases, or if you take these medications for CHF, if you're doing the CHF regimen, GDMT, I would not, tell people to skip those medications, especially if they have real CHF. Anti-epileptics, obviously valprophenizoin, carbamazepine, Keppra, any of these medications. Also, I'll tell people, we don't skip them. Obviously, we don't risk a seizure. Many of the immunosuppressed, patients who are taking Tacro or cyclosporin, mycophenolate, prednisone in transplant patients or patients with CJD, we don't skip it. We don't want to risk infection, even an opportunistic infection. And antibiotics, so especially patients who have serious infections, somebody who has a serious infection, a significant cellulitis, obviously anybody who's septic anyway probably shouldn't be fasting. We don't want to skip antibiotics. antivirals for for HIV, hepatitis B, and steroids, especially long-term steroids, as all of us know. If you stop those steroids, you can precipitate an adrenal crisis, which can be life-threatening. So we don't want anyone going into any of those cases. So these are a small example group of medications that should not be skipped. Obviously, there are many more medications. These are just some of them. A few more would be Parkinsonian medications, levodopa carbidopa, which is the gold standard. Even stopping one day can lead to some significant rigidity or withdrawal. And obviously, many oncology meds, even the oral ones, the tyrosine kinase inhibitors, Gleevec, Sprycel, of Revlimid, which is used for multiple myeloma, Xeloda. These are medications that also, in almost all cases, have to be taken daily. We don't want people to skip these medications because the risk of giving some opportunistic, oncologic tumor to return. So we try in most of these cases also not to skip. Okay, what medications could be skipped? So I think statins, unless you're a real, Michigan cardiologist, I apologize, but I think most people can skip a statin for one day. And it's hard for me to imagine, again, and maybe I'm wrong, but it's hard for me to imagine, in my medical knowledge, how skipping a statin for one day, can have a significant high risk. Zetia as well, fish oil, most vitamins and supplements, even if you have, anemia, the iron, the PO iron that you're taking is not really doing that much. It's really the IV that in most cases that's severe. So I think most people can skip, a daily vitamin. There's somebody in my shul who takes vitamin D like very seriously, and I really have to sit with him and like, I'm telling you, you can skip vitamin D for 25 hours. Nothing will happen to you. You will be totally fine. He probably actually maybe even has hypervitaminosis because he takes so much vitamin D. But typical cases like that would probably, in almost all cases, would be okay to be skipped. PPIs, H2 blockers, Nexium, other medications like that, famotidine, those would be okay to be skipped. Again, most antihistamines, especially if it's not for respiratory patients, it's really just for allergies. So if you really want to take them, you could take them. But, if you don't have a severe allergy, I think it's okay to skip some of them. And Synthroid is a bit tricky. It does have a long half-life. Unless your endocrinologist says specifically you must take it, I think in many cases, patients have a good half-life. And metformin also, in many cases, would typically be okay. Again, if you really think you need to take it and there's no danger, you could take it with some Pekimas Hamayim. These would be some typical medications. Okay, let's pause here for a minute, and then we will let's do some questions. Let's
Yeah.
finish the last two, Moish, and then we'll round up because it's the last slide. Just two
So,
more important points that if going to shul will lead somebody to be eating instead of, if they stay at home and they rest and relax in a air-conditioned room, they won't break their fast, and then they should not go to shul. If they know that by going to shul they're going to be weaker, so certainly they should stay home. There's no have to go to shul and then break your fast. It's better just to stay home. And obviously, if you have a decent headache and you think lying down might help you, and you're not a cholish posakana, so it is better to lie down first. If your headache doesn't go away and you're very uncomfortable, nafal mishkav or ein basakana, you have a systemic discomfort. So then you could go take your medication as a dry swallow, or with the water being a little bit bitter. But lechatchila, one should rest if it's a non-life-threatening illness instead of taking medication to alleviate their symptomology. Okay, that's the end of the slides. So I think that's enough for the slides. I'm going to stop the share, and then we can go back to some question and answers if you are interested.
amazing. Okay, so Yashikoch once again for that second part. Okay, so this is an interesting question someone mentioned. So we mentioned if it's, and this is a well-known sock, if it's breaking the fast versus going to shul, you stay home, you stay in bed, you do what you got to do, get through the fast. What if it's a medication versus going to shul, meaning that they have to be samach on taking a medication with which could be with something that could be game versus just not taking the medication. The example was, let's say someone has ADHD. They'll go out of their keilah if they go to shul without their ADHD medication. Is it better that they take the medication with a little bit of liquid that was nifgam, or just stay home and figure it out?
That's
Very
an
creative.
excellent question.
It's
I,
very
I, got,
creative.
I got to give whoever asked that question an A plus for creativity. How are they going to be at home if they don't take their medication?
They'll be whatever. They'll be running around, bumping their head into the wall, playing with the kids. It's just in order to sit because in the shul, it's pretty much their tefillah versus taking medication with a shinoi. That's what we're
It's
asking
a,
here.
yeah, I understand. It's an excellent question. I would tell that person to call me after. I don't want to put that on the the public forum. I want to discuss that personally with them to get some more
There.
details. But that's an excellent question, and it does have an intersection of a lot of halachic shilos. That's a very good question.
Okay, great. One of the things that we didn't have on the list was birth control. Let's say the person takes the birth control in the morning, so they can't take it just before and just after. Let's say the time they take it is the morning, and if they mess with that, they might have spotting or other issues. What should they do in that scenario?
So there are a lot of different birth controls, as you know. Timing is quite critical. There's a lot of different ones. For many of them, skipping a dose is an issue. In those cases, I think what most people say is they should try to dry swallow to try to dry swallow if they
Are
can.
there any, as a provider, are there any medications that you would say, B'Shem Panim V'Ofen, do not dry swallow it? This is gonna burn your esophagus. Something's gonna happen to you.
I'm trying to think off the top of my head any classic medications that would be for a non-life-threatening illness that will cause significant gastritis. I mean, steroids are the common example that can significantly increase the risk for gastritis for an ulcer. But again, in most cases of steroids, most people have had to take the steroids. For taking it for long-term use or for an asthma exacerbation. In all those cases, I tell people then they need to take the medication. You're not going to risk an asthma rebound for somebody because they can't take the steroids. So in those cases, that would be a common medication on top of my head that does cause, some intestinal risk, and therefore those patients who have to take it, they should take it with some type of food to help placate the side effects.
Got it. Someone asked if someone has a severe alcohol dependency, what's the answer that we normally tell someone like that?
You have to, what do you mean by that?
I don't have that much information. Let's say the person is they're addicted. You're probably gonna put them nafal mishka if they don't get either a medication or the actual alcohol form.
I mean, okay, let me give you a little bit of a different case. Now, obviously, alcoholism is a disease and we shouldn't shun people for it. And some people, there's genetic preconditions, there's abuse and there's trauma while they suffer from it. But it's going to sound strange, but somebody who is a severe alcoholic, well, if they do withdraw from alcohol, they're at risk for delirium tremens. It's a real risk. Their GABA receptors are diminished. And there's a pretty significant seizure risk for many of these people if they'd have to withdraw from alcohol. So if that would be the case, I know it sounds strange, but theoretically, somebody like that, and from a straight, medical perspective, if they're unable to wean themselves, off the alcohol, withdrawing from that would be a sakana for them in most cases. Again, it's a very sounds funny saying that, but again, for them, if they're unable, they're in inus. I think they're on an island, right? So they have nothing else. All they have is the alcohol. If they withdraw from that, they have a significant risk, and a chanami, something like that, should continue it. Obviously, that's more complex because you have the whole psychosocial aspect of alcoholism and other treatments. But a straight withdrawal from alcohol, even versus, let's say, narcotics, which doesn't have that high risk, there is a decent risk for a significant medical episode. So I would say probably, something like that should not jump to abstinence. Right there, he should speak to his medical team how to approach it. But typically, yes, I would say that would be that case. Also an interesting
Got it.
question, but a very, very, very good
Yeah,
question.
very. We have some very
I
creative
mean,
individuals.
it sounds like I'm telling you that you should continue drinking. Obviously, everybody understands what I'm saying over here, right? Withdrawal is dangerous. So if you're unable to withdraw, then you have to, do it with some chachma.
Right. Okay. Someone asked, they want to know, as the Rav is a specialist with kidneys, kidney donors, how soon after or never? When do you
Oh, excellent,
advocate?
excellent, excellent question. I had somebody in my shul who just gave this. So it is a little bit of a shaila what the duration is. As everybody knows, you can live with one kidney. Many donors do well, but the opposing kidney often takes between 2 to 3 months for it to properly, adjust to missing the parallel kidney. And many of the transplant nephrologists say 2 to 3 months you should not fast. In a case like this, I could hear, the person on my shoulder is about 6 to 8 weeks, right on the border. So in his case, we discussed an IV because it's hard to say there's really, he's already at the border where he's probably okay. And the doctors also said probably okay. So a case like this, which is very rachadik sakana, in a case like him, typically we would say, an IV would probably be appropriate because it's not really a valid sakana. But most transplant nephrologists will say shortly after, again, you'd have to speak to your transplant team, but shortly after there is a high risk for the other kidney, and therefore, some type of if they need oral, that would probably be appropriate shiurim in that case.
Got it. Thank you for that. Um, okay, wait, another one. Oh, like caffeine withdrawal. Let's say someone has severe caffeine withdrawal. They're gonna be nafala mishkov. It's gonna be forget about it, high level migraines, nausea,
So
etc.
those, yeah, so
I
those
think
people, I would tell them what they should do. I mean, what's best is to take the caffeine Tylenol suppository. That would be the best answer for them.
so. Their question was posed: if that's not available, is it possible to take a oral caffeine pill?
Without water or with the water that's pug. I mean, either. So
Well,
yes,
that's
the answer is
machalik,
yes.
yeah.
Yes, it's the same thing, right? Again, dry swallow or water that's pugum in halacha for a chay that's nafal mishkav, it'd be the same thing. I mean, I myself many years have done that before. I have other medical issues now that are relevant that change the calculus. But many years ago, I had a terrible, terrible, terrible severe shiurim, and I would take some caffeine repletion on Yom Kippur. So if you can dry swallow or be pugum it, somebody like that, yes, that would be okay.
Okay.
Yes, that would be okay.
Okay. And again, I would imagine this all nichlal, again, contraceptives, any psychiatric meds of non-life threatening when we're dealing with just dry swallowing, these things are
That
all
that would be best. I mean, obviously, bipolar lithium, those are much more complicated illnesses, but for a typical person, the half life of the SSRIs is very, very long. The SNRIs is a very long half life. In most cases, it probably would be okay, to either skip or if they want, if they have a concern, there may be some small side effect, so then they could potentially, dry swallow. But again, you have to discuss each case, what dosage, what combination are they on. So that's where usually I would try to incorporate the provider into the conversation and the patient's
amazing.
history. Some people, they have different reactions to stopping things than others.
Right. Okay. So that closes it out. I'll say a final word after the Rob, if the Rob wants to have any closing or anything that you want to share before ending this.
Yeah, no, I just want to say again, like, we began with, it's really impressive to see so many people here who've Rath Hashem to learn more. And I know a lot of people here are some of the major Bali Chesed. They're doing a lot of Chesed. So again, just to give you, a bracha to you and your families, that you should have the Gezunt, the Mazel, the Chizuk, and the strength to keep helping Klal Yisrael in many ways. And like we said at the beginning, this Chos HaRabim should be Teile Banu. Kabar should give us all a really good bench to Yar and a Gemar Chasima Teva.
Ameno, once again, we just want to thank our sponsor, and it's I forgot to mention earlier that it's a weekly Parsha sheet that's available as well via email. If you'd like to receive that, please, I want to share the links as well in the chat. In addition to Mirza Shem, we're going to be sharing the YouTube link hopefully late tonight. That email for the Parsha paper that of the sponsor is torahsweets@gmail.com. That's TORAH. Sweets is SWEETS. So that's exactly as it sounds at gmail.com. And we thank everyone for joining us, and we look forward to sharing future shiurim with everyone. Thank you, everybody.